The broadcast is now starting. All attendees are in listen-only mode.
Hi, everybody. This is Kara with Senior and Disability Services. I'm just changing my view here so you can probably see me a little better. We're just getting started here with our webinar about HIPAA compliant environmental modification requests. And we still have people joining, so we'll just give a few minutes for folks to join. No worries at all. Welcome to you, Karina, Deborah, Dee, Ellen, Kelly, Michaela, Olga, Melvin, Sarah, and to Sina. Myself, Kara, and Sina we're both here. You might see Sina answering questions in the background and responding to your texted in questions as we go. But we are here and we're ready to talk about HIPAA compliant EMODs. Just try to make it so that I'm not standing in a shadow here too much. All right. So I'm pretty sure most of us know how to work the webinar. You can use the text area or chat area to write in questions, or it might say questions. I did put some handouts into the download handout part. So if you look somewhere around your webinar screen, it should say handouts or downloads or something like that. If you can't download them, don't worry, because the sometimes your device that you're attending on doesn't, do downloads, and some of the phones and tablets and stuff like that won't do that, or perhaps your security settings are set like that. But no worries in any case. We'll go through the training and we'll have time for questions at the end. We have a little poll at the end or a few question and answer opportunities for you. I did ask people who were registered to share their biggest questions with me. Mostly just general questions, how do I stay HIPAA compliant when requesting EMODs? Today, we're going to focus mostly on the HIPAA compliance method part, rather than the actual content of EMODs and what's covered and what's not covered, those types of things. Although I welcome all your questions. If you have questions about those things, we'll talk about those too. So I only had about 14 people sign up, so we'll go ahead and get started with our presentation. Okay, so today it's all about HIPAA compliant EMOD requests, and these are our common questions that we had from our session, this session and last session. What is the elevator speech on what PHI is and what it isn't? Why do so many things that aren't directly related to medical info fall under PHI? What about not having providers in the area or anyone who wants to work in that area? We'll talk about that a little bit. That might be a problem that's a little bit bigger than the scope of our training today, but it is something that's on people's minds, and it's good to know. We always wish to increase numbers of our EMOD providers, and that's an ongoing thing. It's been happening that way for years. So how do I obtain the EMOD my individual needs without compromising PHI? Your clue here is that we'll send an EMOD request filled out to all providers, or how do we, because of the need to send the EMOD request, which is filled out to all providers, and proving response or no response. So those are the questions that are main ones in our world. If you have another question that you would like to have answered that isn't in this theme here, you would be more than welcome to go ahead and put it into the question area, and I'll read it out, and hopefully our presentation will answer all of your questions as we go. Okay. So we do have a training statement. We are intending to present and review processes for care coordinators and requirements when requesting EMODs, environmental modifications, and to equip care coordinators with info to make a successful EMOD request. So we'll talk about the purpose of EMODs, resources for staying HIPAA compliant, and a change in methodology to request them. By the end of our training, you should know how to demonstrate you should know what PHI is, and at least have the ability to answer a few questions about what is likely PHI, protected health information. You would have awareness of revised requirements for EMODs. You will be able to identify documents for a compliant EMOD request or resource to make sure that you do have documents that are compliant, and demonstrate an awareness and requirement of our new EMOD 01 form, which is simply a guide to help you make a great EMOD request. And it's new, so we'll talk about that. First, we'll talk about what PHI is, a little bit about HIPAA Basics. Our enforcement here is through our provider enrollment requirements, and I'm going to go ahead and try to open that little link there and share them with you. We don't have to read these out, word for word, but I did want to let you know that there's regulatory requirements around these, HIPAA practices, so that you don't really have any doubt about that. It's actually in a bunch of different places in our world. So provider enrollment, particularly, it is in number 3, complying with federal and state laws as they apply to providing health care or related services to Medicaid recipients. So the 105 is our overarching Medicaid regulation set, and that's one place where you'll find it. Everybody who's certified as a provider is working with the 105 or under the 105. We will look at our provider COPS now real quick here. It does exist within our provider conditions of participation, otherwise known as our provider COPS. We shorten it to that. And let me find that for you. Sorry for the flashing screen. All providers work under 2 conditions of participation. One of them is the provider one, and the other is the service that you actually provide, that you're certified to provide. So you can see here under certification requirements that there's a requirement to provide a policy and procedure on protected health information, including a notice of privacy practices. So the notice of privacy practices is like, I know that you've been to the doctor's office and you always get a notice of privacy practices when you update your info, or if you're new to the place. It's a HIPAA requirement. It just tells you, the customer, how your private information will be protected. So we have that as agencies and providers of services too. You should also have an agency release of information form that is not the same form as the ones that we require for you to interact with us, for eligibility and requesting services. Through that process, those releases of information forms are just for, working with a person interacting with SDS. If you want to have a person give you authority to talk about their private health information with another entity, for example, if I asked my care coordinator to, talk to a different DAHAB agency for me because I wanted to have another agency serve me, and I wanted them to talk to my current agency about what I need and how to do that best, that's fine. I would fill out my care coordinator's release of information for that. So in the world of release of information, and I'm pretty sure that most of us are familiar with those things. And let me go back to my PowerPoint here. I have my PowerPoint. The last link here is a document that is filled out through our certification process. And I'll open that. And then I'll grab it. Looks like that. Certification application policy assurances. This tells that we assure through the certification process that we have this type of policy and procedure developed, and there was a responsible person who did that, and it's right here in this area here. So it includes what information is considered protected health information. That's what's in the policy and procedure, how the agency will train employees and volunteers regarding PHI, the agency's process to address violations of the confidentiality policy should they happen, and notice of privacy practices, which you would give to your clients. Okay. So before I talk about PHI, I do have a document to show you what is PHI, and it's in your download too. I would like to ask you, what do you think about this question here? When you send an email, we're talking about electronic PHI here. Protected health information can happen anywhere. It can be in a file, it can be in a cabinet, it can be on a desk, it can be coming in on a fax and it's on paper. It could be spoken information. If I talk about somebody's case or medical needs and things like that in public or amongst people who don't have a need to know. Okay, but when we're thinking about electronic PHI, it's electronically shared PHI, this is kind of where we're focusing at this time. So I want you to tell me what happens when you send an email. When you hit send, does it go directly to the person? Is it automatically secure because it's only that person's one email address? Is it just like a phone? Is it just like a fax? What happens after you send an email? Does anybody have an idea or thought on that? Where does it go and what does it do? And I'm looking at our question box so that you can type me your ideas, your answers. What happens when you send an email? How does it work? If you don't know, that's okay too. What do you think? Anybody? You might be typing, so it might be taking its time to show up. Ask the Geek Squad. That's a great answer. There's no wrong answer. I had to look it up too, so don't worry. Ask the Geek Squad. Okay. Well, cool. It's okay to not know. But this was new for me. And I wanted to share it with you because everybody uses email. Deborah says it goes to a server hub, which then is filtered out to other places. Yes, it does. You're right. You're right. It goes to a hub and then it goes to other servers depending on where the person is and how it's routed, but it doesn't go directly to the person. There's no pipeline directly to that person. The internet is definitely thought of as like a net where there's lots of different channels or threads upon which these things will travel in order to ultimately reach their destination. So let's open a little website here. Again, there's tons of information out there on the web, and I did give you the handout, and it has the links in it, so you can check it out later when you have time if you want to. But I thought that it was pretty cool and simple to understand what happens to email. We do not have to read the whole entire thing. You can read it later if you want. Again, it's just one of many, easy to understand, explanations about what happens to an email. It even tells you here why did they use the little at symbol when, they made an address and things like that. So, but we're not going to worry about that stuff right now, although it is kind of cool to know. This picture here really I thought was the best way to, in my mind, to think about it. You compose the email, it goes to a server, goes to another server, and then it goes out through the internet. Depending on where the person is, it goes to their domain. There may be a local server for that, then to their account, then to their computer here. So there's a whole lot of areas there for what to happen. What do you think might happen along the way as an email makes this more complicated than this journey, um, to its destination? In this example, they're sending email to arrakis.com. What do you think happens along the way? Someone else may see it. Extra points if you answer something funny about Arrakis. A worm might get it. That's a hint. Okay. Someone else might see it. Certainly true. You run the risk of having any of these locations be hacked, and people can intercept it. Yep, it can get lost, intercepted, changed, and shared. Yes, all of that. All of that. Okay. So good answers. You are absolutely right. We'll go ahead and pull this up again. So if something gets lost or stolen or shared or intercepted and there's information there, what do you think happens to stolen private health information? In your opinion, in your thoughts, what do you think happens to that information? Is it good information to get? Would somebody who's out there to steal information, what would they do with that? What do you think? What happens to stolen health information? Anybody? It could make the person look bad. Yep, it can do a lot. Let's take a look at the website and we'll get that answered here. Again, this is another website. There are many out there. Answer says it can be used in nefarious ways to blackmail the person who the info belongs to. It can end up on the dark web and other ways that will negatively affect them. Yeah, those things are entirely possible. So this tells us what happens, some things about what happens to stolen healthcare data. So data breaches in healthcare information are a big deal because a lot of the health information can be used for things like identity theft. It can be used to create and receive bogus prescriptions because it's health data. So it can be used to, get prescriptions done online for somebody who's entirely not the person who needed it, and then they go ahead and sell those. I thought it was interesting that it says that the value of medical records on the dark web has surpassed the value of social security and credit card numbers. So medical records can sell for way more than social security numbers and credit card numbers because there are, built-in blockers or non-acceptance of bogus social security, or that we don't ask for it at all. And then credit card numbers, they could maybe only be used for a little while and then the person catches on and then it's done. Or something, the credit card company will call the person when they see something odd happen. There's just so much going on to prevent those things that they're just not as valuable anymore. So what is valuable now is health information, because it can be used for anything. They can definitely be used to leverage details for blackmail, like you said, long-term identity theft, making people pay for information like, I know this about you, now you need to pay me to prevent me from putting it out there for everyone. The person can commit tax fraud or get a bogus loan. on a person's home that they own. Somebody else takes a loan out with their home as the collateral, and they don't even live there. So then people come up with these bad credit and a lot of things that people don't even understand how it happened. And they start getting bills for things that, they didn't buy. And that is really upsetting, or would be really upsetting to everyone who would happen to. But the people we serve are especially vulnerable because not a lot of people understand those things. People are in a place in their life where they need a lot of help, and people just really don't need that kind of thing happening in their life. So the other thing to know is that in the article anyway, it says that healthcare doesn't have super strong cybersecurity practices. So, when we send out PHI without using an encrypted email, that exposes PHI to all those places, but that practice is unfortunately more well known to happen in the healthcare industry than it is in others, like banking, for example. If I'm going to do a loan, going to get a loan from a bank, they're going to have a whole separate website for me to go on and put my data in and things like that. We don't always have that. Sometimes we have patient portals and things like that, but especially when we're working with people who get services from a Medicaid provider, it's not always the most convenient or understandable way, to interact, to keep your information, private like that. So anyway, these are things that can happen, and I just want you to know about that. Okay, so here's my website. Again, you can look at these, you can look at the details using the link, but it does have a nice article that talks about all those things, about stolen patient data and things like that. Okay. Those are definitely not things that we want to have anything that we would do that might jeopardize a person's information, or result in any of those things, obviously. So let's talk about what PHI is. Let me bring this into the screen. I did put this into your downloads here. PHI, not much has changed about the definition of PHI, and we certainly have been training it for quite a while here through SDS training. The same research exists in the past, which identifies PHI in this list that you'll see here. It's in alignment with the Federal Registry definition as well. It individually identifiable health information. Anything recorded or orally transmitted. By recorded, it could be on paper or digital, which was created or received by a healthcare provider, plan, public health authority, employer, life insurance, school, university, healthcare clearinghouse, relates to the past, present, or future physical or mental health condition of an individual, the provision of care, or the past, present, or future payment for provision of care to an individual. So we do have a list here of individually identifying information that is not exactly specifically related to only health, but because of our work that we do and because people come into the programs because they have either no resources in the case of general relief or they have Medicaid, that is a financial qualification. So that a person comes under a limit of income to get Medicaid, and or they come under that Medicaid with a disability. So that, of course, would bring the medical part in. All of the services that we do are medically necessary. So because of that, every single piece of a person's identity is going to be private health information. That doesn't mean that we can't, help a person in the community be a member of the neighborhood, and we can't introduce people to other people that live near them or that they wish to get introduced to. No, it doesn't mean that. It doesn't mean that the entire person's entire life is a secret. This is talking about medical records of what we might email. So this is your list. Name, address, everything except for the first 3 digits of the zip code or just the state they live in. Date and place of birth, date of death, elements of dates except for the year, age except for like general categories like those under 21 or people older than 90. Race, marital status, a phone number, fax, email number, social security number, generically medical record numbers, and the rest of them, names of relatives, account numbers, certificate or license numbers, vehicle identifiers, device identifiers, internet protocol, address number. That would be your computer, how it goes onto the internet. It has a series of numbers that is IP address. Your web resource locators, URLs for a person's computer. And then there's biometric identifiers, a finger print, voice print, full face photographic images, anything that compares to that. Not on the list is some of the very latest identifiers, which is DNA results or DNA genetic, components. That would also be protected health information. We don't really work with any of that, in our work, but it's under the health industry, so it's the newest category. It's not on here because it wasn't really prevalent in 2011 for people. But not much else has changed about it. Anything on here surprising to you on this list? Anything? What's a surprise to you that could be considered the PHI or any other thought about this list? Questions? No questions? Okay. Okay, that's fine. I'll keep my eyes on your
Hey everybody, it's Nina.
hi.
Hi. I have a question,
Okay.
and so I'm just throwing it out there, and I want to see what the group thinks about it. Actually, can you pull that checklist back up? That'd be good. We often see initials and a case number in unsecured email. What does the group think about that now that you've reviewed this list?
Not a good idea. Yeah. We can use our secure email for that. If that is, that's, again, we're not here to dictate change in practices for specifics, but we're here to share what is considered PHI so that logical and, doable changes could be made if they need to be made. And that's up to different teams. They can decide. Okay. Point number 2. What do you think, Sina?
Yeah, I agree.
Okay.
It's really difficult to use non-secure email to have any kind of initial and a case number or really refer to your client at all in a non-secure email.
Right. You could definitely do like a case example without mentioning names or anything, like a situational stuff. If you were going to do like a case study or process with somebody and questions and things like that, as long as there wasn't any of this in it.
Sure. What I think is really interesting is care coordinators are very, very skilled at this.
Yeah.
Because,
oh, yeah.
You guys know that I monitor your Facebook conversations occasionally. And It's a skill that care coordinators practice very, very well. I see it actually coming from other state entities.
Yep.
Or other provider types that don't understand this.
Yep. Okay, awesome. So now that we have talked about PHI, I would like to demonstrate for you a couple things. So now you know the direction that we're going is we're going to talk about how to find a list of current EMOD providers, because as you know, your conditions of participation require a care coordinator who's going to request an EMOD to notify all EMOD providers. Okay, so what we're getting at here is to equip you with information resources so that you can do that and make sure that you're not sending to non-secured addresses from a non-secured address, and to explain the process so that there's a few things that you can leave out and a few things that you do that are different, to comprise the entire EMOD process. So let's talk about how to find a list of current EMOD providers in Harmony. And let me get my Harmony website up and happy and ready to see. So this is our training Harmony site, and we don't have real customers in it, if you will. We do have real providers in it, but that's okay. It's not PHI, they're a provider. I have made sure that my role within Harmony is the care coordinator, read-only role. And that is the correct role to have, which is the only role you have as a care coordinator. I'm going to go to the Providers tab first, click on that. And in the Providers tab, I go to the left where it says Reports, and it says Certified Provider Search Tool. So I am looking for certified providers of EMODs here, but I'm going to click on that, and it's going to bring up another box, a pop-up, if you will, that tells me that I'm looking for providers. So I go to the first box here, or first drop down that says certification service or services. I can choose more than one. I am here to talk about just environmental modification. So I am going to choose both agency and private. So don't worry about that, whether it's agency or private. That is two categories that came over with our conversion. Really just has to do with certification, doesn't have to do with anything they could or couldn't do for your client. Okay, so pick them both just to make sure. I'm going to leave all these checked, and I'm going to leave all of the entire Alaskan boroughs checked so that it tells me all the providers. And then I'm going to go to View Report. And it's going to load a report for me. And I have choices of format that I might want to have the report exported in. For example, if I go up to this little teeny picture of a floppy disk, which is odd, but that's what it's a picture of, you can export it in different file formats that you might pick. It doesn't matter which one. We could try this one, and we could save it. We could save as, give it another title, something like that. I'm not going to worry about it right now. I just want to show it to you, just so you know you can keep that report in different formats. But I do want to show you that we have, see it says page 1 of 1. There are only 8 certified EMOD providers right now. So we have Alaska Stairlift, and it tells the areas they serve. It has contacts. This is not a DSM address, right? It has their Medicaid provider number. We have Buena Vista, tells you the same thing. Maple Leaf Builders, Rebath, Russ, Norton Sound, Reach, and Wasilla area seniors. Okay. And it tells you where they serve. So what you want to do with this is you want to get contact information so that you can get ready to send an individual email through our secure DSM email system that you have. I'm going to say ours, not just SDS's, it's yours too. You can send them a secure email whether they have DSM or not. Now, you know how DSM works. When you start typing in the name of the place that you want to email, they may have a box that comes up. They may have an email address that comes up that's a DSM one. They may or may not at this point. So all providers, also in our provider COPS, need to be using DSM to communicate securely the PHI. But if it is not convenient, you cannot find it for whatever reason, you can always send them an email from DSM using the process we're going to talk about next. Okay, so just know that there are only 8 of them. So I'm going to close out of that right now. And I'm going to go to my my DSM. Let me just make sure that this was the next thing that I had on my list to talk about. Yes, it is. So how do you send a DSM to a non-DSM address? What does it look like and what happens? Every account with DSM at every level has the capability to send to a non-DSM email address. And what it does is it sends your recipient kind of like a little mini DSM inbox that stays alive for 15 days. So your person who receives it can use a link and a password to get into that little mini inbox for up to 15 days, and they can respond to you. You can respond to them, and they can give you upload things. They can scan into their computer and send it to you. You can scan something into your computer and send it to them. That is how it works. And I did find a lot of help on DSM's customer support page. They're actually their tutorials. They used to have video tutorials on how to do this. Now they just have pictures. But I did verify with Healthy Connect in Prevet DSM that yes, every single DSM account can do this. They were very nice and kind and happy to remind me that, hey, Kara, it's kind of the point of having DSM. So I asked the question, really? Yeah, that's kind of the point. So it was nice to learn this, and now I'm happy to share it with you. So let me log in. And this is my inbox. I don't have much here. I do get email that's, PHI sent to this, but I didn't want to show it to you because it's PHI. So this is just blank here. This is my little inbox with 2 messages in it. So I'm going to send an email to a non-DSM address. So I'm going to compose just like I would any other email. I'm going to send this to our SDS training Gmail account because we have a Gmail and we use it for different things for training. But as you can see, I've done this before. So it does remember the addresses that you put in. Just make sure that if you typed it wrong, if it's misspelled, it'll also pop up a misspelled one. Just make sure that you've got the right one. Okay, make sure that you've got the right address. Okay, let's go. I see your question. All right, I think I have some ideas about that, but let's get further in this so we can, make sure everybody's following along. Okay, so I am going to send, here is some PHI for you. I've had this same, demoed this a few times. So say here is some information for you. This is like the body of my email. Thanks for everything. Okay, I'm going to add an attachment. So maybe this contains PHI, name, medical, DX, info, etc., PHI. So the body of the email could have PHI. Then I want to add an attachment. Go down to the little plus sign, and it'll bring up a search of my computer. The last file I was in here is just pictures and things like that. I'm just going to randomly grab a file. Suppose that was the one with PHI that I was looking for, and I hit upload, and it uploads. So just make sure you follow those steps when you're doing this. We did have a few comments that the recipient doesn't get the attachment. So perhaps the few of these steps were missed and the recipient doesn't get them, but I have some ideas. We'll get to your question when I'll talk about why some of those things might not work, okay? So then I want to send the message. I go down to send, and it's going to send it. And so what happens now is I am going to get a bounce back into my DSM, which you just saw happen. It says message delivery needs your attention. Okay, what's that all about? If I don't open this bounce back and do something, the person will not get my email at all. I have not received anything in my Gmail yet because I didn't allow it to be sent. It was sent to a non DSM address. DSM says, oh, did you mean to do that? If so, here's what you do. So you read it. And it says, outgoing message not delivered. You attempted to send a message to someone who does not have a secure account. Here's what you did and who it went to. Your options are do nothing. If it was a mistake, I spelled it wrong or somebody else, do nothing. You're done. Nothing was sent. You're fine. Number 2, if you meant to send it, you have a chance to check it. Make sure it's the right person. You can send the message to a temporary secure webmail account set up with that recipient. They get an email notice that has a link to that little account and a one-time password. Okay? The alert just says that this tells them that you understand that and that you're still going to protect PHI by sending it to the right person with a need to know, and making sure that that person does as instructed. So it doesn't mean you can send it out to anybody under the sun. It doesn't keep the information private after it gets there, but it keeps it private on its way. So it's up to you to know who's getting it and that's the right way to go. So if you want to proceed, you click here. It says click here, the little blue letters here, HERE. Then you get a new notice, new tab. It says we've sent a notification to the recipient's mailbox that will allow retrieval of the message you've sent. And that is a whole new tab. I can get rid of that tab, but I did want you to see what it looks like. Okay, then I'm back to my inbox. Don't worry. Now, here's my Gmail, right? I just opened up my Gmail, right? Here's me as the recipient with a non-DSM email address. So what did I get? Now I'm using Gmail. So Gmail kind of puts messages one on top of the other when it's from the same place. It's kind of like the same thread, but they get 2 emails. One of them says that here's the link to the message and here's the password. So this one up top here, the first one says here's the link. It says click here. That's the link. And here's the password. So they get 2 separate emails. Here's the link and here's the password. Question said they get the original email with the password, but it doesn't send the link. My thought on that is that either A, it's being sent so fast together that it looks like there's only one. It may be because Gmail does that if it's a Gmail. It's really 2, but you got to open that one that you see and look for the other one underneath it. If it's not Gmail, then the person receiving it may have some kind of a security setting in their inbox that says that when I get fast emails from the same place, it might be spam. So they need to allow you and your DSM account as an authorized sender. They have to go to their spam, junk, whatever, and allow you as a sender so it doesn't happen again. Those are two things that I think might be part of that.
Yeah, Kara, I'm going to agree with you on that one highly, because it took me quite a while to figure out why my very technological teenage daughter kept saying, I don't get that email when you forward it to me. I don't get that email. We all use Gmail. But that was the problem, is I would forward it to her and she wouldn't open up the entire email, and the forwarded email was actually second on there. I get this. This is some like tech support that we have to give to our possible recipients of this email, but that's most likely what's happening, is they're not seeing that it kind of comes in looking like one message, and so they only see the top level message that says you have a message, and they don't see the one that says here's your password.
Here's the one that I got. It says there's a little 2 there. These ones are from the other day, but it says there's 2. You have a message, and it looks like there's only one here, the password, but no link. Where's the link? Where's the link? You got to click on the top one to be able to see it.
Yeah,
So,
and that's exactly what this care coordinator is reporting. Original email, they get the original email with the password, so they open it up and they see the password one, but they don't open up the one above it that has the link.
so what do? Tell them about that, and then here's what I think is the easiest to do. Did you see something?
Yeah. So one of our state care coordinators is sharing. She says, I have found that some agencies only receive one email and the other email goes to their spam. And that's the other situation that Kara was talking about. So I always tell them to check there also. Yeah, the system, their email system is identifying 2 rapid sends from one IP address or whatever to be spam.
Yeah. And the security stuff can be like, maybe they don't accept attachments, and the rapid fire, they think it's spam. They can still go in and have you set as an authorized sender. That's what I would say. If the agency, either they could do it or their IT person could do it. But anyway, in the case of Gmail, the easiest thing to do is, once you know that there are 2, is to highlight that password and copy it. Then go up to here and it says click here, then enter the password, or you could write it down, right? So I am lazy, so I just copy it. Click here, and what does that look like? I get a new tab, and it's a secure out of direct network email box, like a little temporary box that it made up for you and your recipient. And it has the username and whatever. They don't have to remember any of that. They just have to paste in the password and then log in. And when that happens, they'll see the inbox, and they can open and they can get the pictures that I sent or the PHI. You can open it. I did get some questions. It came out over here, but I did get some questions from, here's just the picture that it was. It's kind of just random, but it opened up on my other screen. If people aren't getting if your recipient can't download the attachments, then either they do not have the correct application on their device to be able to open it. In the case of PDFs, that's a Adobe free reader. They may not have that if they're trying to open it on a tablet or a phone. Not every tablet and phone has. Some of them don't even have enough memory or power within them to be able to open documents like that. Not all phones and tablets can download and open documents. Okay, if it's their computer, then same thing. They may not have the application. It may not be updated. It may be that type of thing. Past that, your person, we give this to you in a resource. As I said, DSM's customer service is pretty good. Your person who's having that trouble can also contact DSM's customer service about that problem. And as you can see, they can reply. Like reply. They can print. They can do different things. You can have a conversation with them, for 15 days through this temporary box that was set up for them. And your interaction with them will be documented in your archive, your DSM archive, just like all the others. Yeah, you could probably do a step-by-step instruction for the recipient to follow. Yeah, you could. Yeah, that'd be okay. So this was my Gmail again, and this was my little inbox that was opened for me, based on this procedure.
Hey, maybe before you do spend your time writing up a step-by-step point to follow for the email recipient, take a look at what Prevet already has on their webpage, on their help page.
Yeah.
It's pretty good with a lot of pictures and screenshots and stuff like that. So you not reinventing the wheel, just give them what's already there.
Yeah, the person doesn't have to have a profile. They don't have to have a username. They don't have to remember any of that. They just need to copy that password and go to the link. They can go back to their Gmail that they got and just use that same set of things, that same link and that same password for 15 days. Okay. It says here you will be able to view the message and reply over the next 15 days. They're not going to get a new thing every time they respond. It's just the same link and the same password for 15 days between you and them. Where would I look in Prevet? We'll send you that stuff. We have an email that we're composing to send out that you could have, customer service in Prevet. It's pretty easy to find. Anyway, so that's that, how to send to a non-DSM address.
Yeah, she gave you the shortcut answer, but this is what I'm going to tell you. As a care coordinator, go look up in Prevet.com. It's not a hard website to manage and look for it. I learned so much by going there and finding this stuff, and Kara learned all of this stuff about non-DSM accounts.
Yeah.
Go learn it.
Show it if you
want.
want.
We can, but you will also now they're adult learners. They need to go find it.
You could do like Alaska eHealth Network in Prevet.com and just hit it and then just look for customer service or user tutorials. They have a good page that has all that on there. Yeah.
It's really great, and you will learn skills about what you didn't know you could do to manage your own box.
Yep. You can make a signature. You can do all these things. So, okay, cool. Let's switch it up a little bit and let's talk more about EMODs. Does anybody have any questions, any outline questions about the sending to a non-DSM email address yet? Anything else that you had sneaking around in your mind before we move on? I think what I'm going to do is, if there aren't further questions, I'll go for about the next 5 minutes and then we'll take a short break, okay, at the top of the hour, okay? So we're going to review environmental modification services, the web, the regulation on the web, very quickly. Again, we don't have to sit and read this whole thing out for you. We just want you to be aware that there is a link to it there. It lines out eligibility for EMODs, and it more so talks about what is an EMOD and what isn't an EMOD, what is the monetary limit of the EMOD. You've got procedures here that the provider does to make a claim for the service. Generally, they are authorized to be paid 25% or less of the total amount approved for the project. And then after that, when the project is done, they request the rest of the payment, directly to SDS. We'll talk about this more because we do have a document that summarizes this for you, and that is the new EMOD 01 checklist or guidance document that we have. Okay, so this is going to function as further explanation as to what EMODs are and are not. And your guidance document will be the EMOD 01. Okay, so in your conditions of participation for a care coordinator, there's quite a lot out there on that document that is your responsibility as the care coordinator. I just want to grab a copy of the highlighted one that I was working from, I guess I should say, and throw it on the screen. So we don't have to read the whole thing, of course. I'm going to pause it and I'm going to scroll down. You have this in your downloads as well. We can email it to you too, but I want to go all the way down to page 9 and talk a bit about how we are requesting environmental modifications and some kind of common assumptions that we've heard from care coordinators, and to just clarify what it is that we expect. We do have a change in procedure. I do want you to know that we've gone through extensive discussion and agreement through our review teams and our oversight, our leadership teams about these changes. So nothing is really out of line with their conditions of participation or regulation at all. We think that it just, a lot of people didn't know that you could send a secure email to a non DSM address, and there were just some different things that resulted in requests for cost estimates going out to secured address with filled out forms with all the PHI on them. Okay, so that's something that we just want to clarify for you. Hopefully this will make it easier for you to make a great request and stay HIPAA compliant too, right? So request for cost estimates. It says right here, you notify all certified and enrolled EMOD providers by electronic mail in a format provided by SDS. So the format is the form, the cost estimate form. Electronic mail is going to be your DSM. And so because of this list, let's review it. Your notification must include care coordinator's name and contact info, location of the project, a statement indicating the provider can arrange with the care coordinator for on-site viewing of the area to be modified, request for cost estimate form or forms appropriate to the type of adaptation included in the EMOD. As you can see, PHI is going to be in the location. It's definitely going to be in the request for cost estimate. It is asking for photographs of the area to be modified. In our second document that we'll look at, we do also request photographs of other areas in the home that have the same function. So if somebody wants a ramp to a door, we want a photo of all the other doors to the home because of rules about non-duplication of EMODs. Okay, so just so you know, that's if we just are asking for that so we have enough information to make the decision. So that'll be on the checklist / guidance document that we'll look at. And then a notice of a time limit of at least 14 days to submit estimates, unless a different time frame was approved. It could be that you had discussed with SDS about what was happening and they were going to need more time. It's possible, but again, that you can have that little inbox open for 15 days. So it makes it easy. Send an email out to them. Now the last one, number 3, the care coordinator may not disclose, except to SDS, financial information regarding the project or competing estimates, or the identity or number of providers expressing interest in the project. So to do this, what you will need to do is use DSM to send a separate email to each provider. You want to have a release of information on file for, from your person to say, I authorize you to release this information to EMOD providers in order to request an EMOD. Since you're going to send them all the same information, you really only need one ROI from your person, but you will need to send separate emails via DSM to the EMOD providers. Okay, so we're not doing group email, right? No copying. We want to make sure that each provider doesn't accidentally, for example, hit reply to all. I am pretty sure in the case of non DSM email addresses, you can really only send to one. In the case of DSM email addresses, you can send to more than one, but again, in order to avoid, getting information between and amongst providers shared by a mistake of hitting reply to all, you just want to send one. Now, there's only 8 of them, and it shouldn't be too hard. It's not a super common request. It requires a lot of planning anyway, so it's just another. It's a way to make sure that you're compliant with conditions of participation and, of course, with HIPAA. Okay, so it brought us up to the top of the hour here. I would like to give us a short break. We'll go ahead and take 5. And when we're done, a 5-minute break, we'll come back to the rest of the conditions of participation wording here. And we'll give you, information about what you would do. A lot of people are thinking, well, how do we prove that we've sent to all if we're not going to send a group email and then copy to SDS that group email? How do we do that? If you're thinking that, that's fine. We'll explain that when we get back. All right. So we'll come back at like 2:08. So I think it's 2:02 or 2:03 right now. All right. So let's take a short break. Thanks, everybody. Hello, I'm back. How do you like this hierarchy of needs? Battery, Wi-Fi. That's how it goes around my house anyway. All right, let's finish talking about our process here. I'm going to get my file ready. Okay, so your process for this top part here, request for cost estimates. What does SDS expect? You are familiar with the reviewing the need, getting permission from the homeowner, verifying the funding. Those things are all summarized in regulation and in our reference document that we'll look at in just a bit. You want to notify all EMOD providers by using DSM to send a request for cost estimate email in the attachments to each one. Okay. You won't be doing group emails copied to other EMOD providers or SDS, right? That is going to be the new way to do that. We also are wanting to share that, of course, selection of the project provider. We review the received cost estimate forms, if any, and all of ones that we did receive. I know there's only 8 providers, but when they send one, required inclusions for lowest cost estimate or waiver of the requirement. We'll look at that. It's all in the conditions of participation. You will be submitting all request for cost estimate forms received for this project. We don't want a list of all providers who were sent a cost estimate. You would keep that on file at your agency for compliance review upon request. Okay, so we're not asking you to send us copies of emails and list, to all providers. You're not going to include us as a copied on that. You're going to keep that on file at your agency. You're just going to strictly follow the conditions of participation. Okay, so I'm showing that now. You're going to keep those records on file. And for example, if SDS starts to get complaints about, hey, that one EMOD provider gets all the jobs, we're not getting any communication about jobs, or there seems to be a common referral to just one person, then of course, we would investigate that. So that is why we're asking you to adhere to this process and then to keep the records on file in your agency the way that you keep records on file available for review upon request. Okay, so the rest of the COPS, the care coordinator reviews all of the request for cost estimate forms that you received by the date specified. You will look at the one that submitted the lowest cost and determine whether they can complete it in time to meet their needs, and send Senior and Disability Services a selection of documents. You'll send a support plan, could be an amendment, that includes a description of proposed physical adaptations with a photograph and any measurements, sketches, or other relevant representations, all developed by the EMOD provider to show the project plan. So they're going to give you those things. Hopefully they're going to email those to you back by DSM. You're going to put this packet together. You're going to submit that to SDS also via DSM at this time. You'll include in your plan a justification for the project. You will include the name of the EMOD provider that you are recommending or requesting for that project on the person's behalf. If applicable, if it's a provider other than the lowest, you'll have the form about that, waiver of requirement for provider selection, and the property owner's consent to the EMOD form. And you will include, this one's a little different, or at least that's what I hear from our learners, all request for cost estimate forms received in regard to the project. So you will include in that support plan requesting an EMOD a copy of all request for cost estimate forms received. And that's going to SDS. So you're going to keep those things on file. When you got a couple of them, keep them on file. you're going to send those to SDS with this plan, with your request for the one provider to do the work, but we see all the other ones that send something, right? And that is for us to get the info, and it follows our conditions of participation. So there's not a whole lot different here in terms of following the conditions of participation. But you may or may not have experienced a different way of doing it, or requested EMODs in a different way, or done group emails to non-encrypted addresses with PHI attached or not. You may not have. You may have used DSM prior to this, of course, but this is what we're expecting from here on forward. Okay. Thoughts, comments, questions so far? Most important parts here: send a DSM to each provider with the request for cost estimate and the attachments. You make sure you have an ROI on file for the person, so they know their info is being shared. Okay. Not group emails to providers, not copied to SDS. Keep those things on file in your domain, however you keep digital files. Don't send us a list of all who were sent. Keep that on file. You would send us a copy of all that responded with the request for cost estimate form. Question says, if I understand correctly, I should send individual emails to each provider, not in one email. You are correct. Yep, and you'll use DSM to do it. You'll be sending 8 individual emails, but you won't have to work with all 8 people or entities. It's not likely that you'll get a return from all 8 of them. And so the rest of your condition of participation here, it says under number 2, upon written notice of approval, selection of that EMOD provider, the care coordinator notifies the provider selected, and you tell them that you are selected, and any other providers, you tell them that you are not selected. So that is what you can do also by DSM. You can tell the ones that were not selected that they were not selected. And it's usually not, a whole lot of ones that submitted. Okay. You don't have to contact providers that didn't submit anything, right? So maybe of all the 8, you maybe get 2. 2 submitted, 1 was chosen. Something like that. All right. In our conditions of participation, we also have, your role is working with that provider about, what's it going to be like to have that EMOD done for your person? Should they make sure that they have a dust cover and make sure that things are clean while they're working in the home? Like what happens in regards to the person? How are they going to experience that? What about if there are dissatisfactions? What do we do? How do we work it out? When should we call SDS or contact us and let us help? Question says, if only one provider submits an estimate, do we need to ask the others to send a decline? No, because your original outreach to them says, if you're interested, send me something back within 14 days. They don't send anything back in 14 days, they're not interested. So right now, at this time, we're going to take a look at the new form called EMOD 01, and hopefully it'll be a great resource for you when it comes to putting these packets together and putting your thoughts together about it, how you can help your person get the EMOD. We are hoping that this will be a great resource for you and that you will find it easy to follow. Our old checklist that we had with the boxes and red and green and things like that, well, kind of the start of the story here is that all of our documents that we do post on the web must be accessible to a person with a disability. such as a person who would use a screen reader or something like that to read the document, out loud. All states are in the process of updating their websites for documents like that. And so this is just one of the documents that we had in our starting here of the project, to replace the old EMOD checklist with this planning guide. And this is an accessible document and meets those requirements. So again, we're hoping that it's got plain language and accessible for readability and for, of course, its formatting. Okay, this is a general guide to help you, the person, contractors, guardians, anybody who's involved with the EMOD process. It provides a summary of the service. So here you can see information that an EMOD is about helping a person be more independent in the home or to adapt their home to meet their needs for accessibility. So an EMOD is not going to be requested for something we think might happen in the future. Like my knees are going bad and I need a ramp or I need a stair chair or something like that. That is not going to be something that I need right now. It has to be something that's current and chronic, which just means they need it for everyday life because of their disability. The care coordinator can be an educator about the process for the person. The EMODs are always completed by a certified construction contractor. Not just anybody can do them. They have to be certified just like all of our other providers because they're billing Medicaid for this. Cost limit cannot exceed $18,500 every 36 months. They need to complete the project within 90 days after the start of construction or initial payment made on a claim, whichever is first. So we do sometimes see EMODs that are about, for example, restricting the person, like we need to put up a fence to keep a person in. It really isn't an EMOD thing. EMODs create accessibility rather than restrain. So that's why we have this up front, so people can understand, a family can understand better what this is for, right? So you can always review regulations. We sort of did already. Paperwork to a complete EMOD request would be the forms. So current forms on the website, property owner's consent, cost estimate forms, whichever goes with the project that is being requested, photos of the area, and here it says all areas used for similar purposes must be documented. Okay, so the contractor could take these photos, you could take these photos, either one. And sketch of the project from the contractor. So the contractor is going to give you much of these things. It really isn't, your zone, if you will. It's their thing that they're going to do as part of being a certified contractor. Factors that may impact approval of an EMOD. These are guidelines. It's not like, to follow this, it's a guarantee that a request is approved or denied. There's always some circumstances that are different for every single person. So we try to give a best answers here. An EMOD could possibly be approved if it is there to meet the person's current and chronic needs. It modifies their primary residence. The property owner has given consent. The cost estimate forms are completed fully and on current forms, not the contractor's own business forms. We do see that sometimes. Has to be on the SDS forms. On our approved forms page. Each project is separated by an appropriate cost estimate sheet. Sometimes we do see, like in a contractor's mind, they want to kind of put everything together on one, That's not what we need. We need separate. The provider with the lowest estimate is awarded the project. However, if that is not going to work for the person, you can submit that form that says, we need to pick a different one and here's why. That will be reviewed and signed by our SDS director. So it has to be a legitimate, reason why, like they can't complete it in time or something like that. And then it doesn't exceed the monetary limit. And so here's the factors that will not be approved if the request contains them. If it modifies an assisted living home Group home, residential supported living home, those are not eligible to receive EMODs. Family habilitation homes are. Again, they need to be approved on a case-by-case basis. Also, it is not for a temporary residence, so definitely ask your person if they're going to move within 3 years, because we're not going to take out the EMOD and have it follow with them. If it only indirectly meets their needs or are temporary or for future needs. EMODs do not modify new construction. They're not part of a planned renovation or a renovation in progress. EMODs do not increase the square footage of a residence, like making a bathroom bigger by punching through a wall because there's a closet behind it. We don't add to the structure of the footprint of the building by converting garage, carport, or outside space into something that the person would use. It's not for repairs or routine maintenance that the homeowner must take care of. Broken flooring, heating system, things like that. That is going to be the homeowner's responsibility. It cannot be requested for prohibited items. Hot tubs, sauna, hydrotherapy devices are not allowed. Elevators as well. It's not on the list, but not part of an EMOD. They cannot include feature material upgrades, including privately purchased or donated materials. We cannot accept, like a marble countertop from somebody's family member instead of the one that is a basic countertop, basic heavy duty grade materials. Okay, so it has to be standard things that we put in rather than custom or donated things. It cannot be work or improvements to outbuildings, yards, driveways, or fences. It cannot be something that is there to constrain or restrict the person, which we already talked about. EMODs are not authorized to duplicate EMODs that were already done regardless of the funding source. So if one bathroom was modified from a grant, an EMOD would not be requested to modify a second bathroom. If a ramp is installed to the front door, an EMOD request, you wouldn't make an EMOD request to do a ramp to the back door or the side door, because it's duplicative of the resource. And then at the end, we have a new/old requirement. Way back in the day, we used to require a care coordinator's signature on a document like this prior to the checklist we had. So depending on how long you've been doing it, you may or may not, remember, but this is just an attestation. You say with your signature that you've read the planning guide and that the request for this EMOD is compliant to the best of your understanding based on these regulations, and you are ready to submit it. So you just put your signature and date, and that will go in your submission packet with your plan or amendment which requests an EMOD. Okay. Again, a guidance document that hopefully helps you put together a great request. We're hoping that if you read this through and kind of go step by step and just make sure that the EMOD that's requested fits these guidelines, then submit it for approval. If you get stuck, you can ask for help. Of course, you can ask if you're already working with a reviewer for this. It could be some back and forth with our teams. Of course, teams may say, hey, I didn't understand that. It really is just about getting enough information to make the right decision. That's what it is. It's not, any kind of other scenario that you can imagine. It really is, we just need more information to make a good decision, to make the right decision on the person's behalf and in respect to regs. What are your thoughts and questions about this document, EMOD Planning Guide? It is on the web already in approved program forms. Thoughts, questions so far? If you don't have any, then we'll do a little quiz. Again, you'll go to approved program forms to pick this up. make sure that you review it, get your questions answered, and when you're ready to submit, sign it, put it in. Okay, cool. Easy to read through. Awesome. We're trying to make our documents all accessible for readability, which is too many words to say plain language. Yeah, we're hoping it's a way to help make sure the process is complete, be it that it is a long process. I'm not saying it's, shorter, but there are a few things that are different here that you don't have to do. You do have to do eight separate emails, but you don't have to copy to SDS about all of that. And you certainly wouldn't go do any of that outside of DSM, for your attachments, because the attachments contain PHI. Okay. All right. So are we ready for a quiz? It's a fun quiz, I hope. Last time I did this, the internet was slow, so it wasn't so fun. It was kind of frustrating, but we'll try it. I'm going to select a poll, and I'm going to launch it, and hopefully you'll see my poll, and you can click on it. What's PHI? Age, medical record number, the state the person lives in, or only numbers 1 and 2? What do you think? We'll wait till most of us have voted. What do you think? Number 4, okay. You can click right on the webinar display that you see there. Okay, looks like most of us have voted, so I'm going to hit close and you'll see the results, hopefully. And it clicks to that thing, but it'll show you the results here. Maybe. There it is. So the answer is actually 1 and 2. Okay, number 1, the state the person lives in and of itself is not PHI, just that. Okay, so it is number 4 would be the correct answer, the best answer to that. Oh, hang on. I'm going to hide those results and go back to another poll. All right. So what is PHI again? Is it internet IP number, date of death, vehicle serial number, or numbers 1 and 2 only? Okay, it looks like most of us have voted. Go ahead and close and share. So our answers are mixed because it's a little confusing. It's actually a little bit wrong, but but anyway, 1, 2, and 3 are all on the list. Some of us chose date of death. That's related to their health info, of course. I guess the best answer here would be number 4, because internet IP number is on the list, date of death is on the list, and serial number is on the list too. but based on what you see, probably number 4, best answer. All right. Here's another one. A care coordinator should send a group email with PHI to all EMOD providers with the EMOD request form attached. Yes or no? Okay, we got that one pretty easy. Easy. That one was, of course, going to be a no. Okay. Let's try this one. I told you it'd be easy. I just want to make sure you remember what we talked about. You can send a direct secure message to someone without a DSM account email. Yes or no? Okay, easy. That one is going to be a big yes. You can do that. Okay. Here's the easy one for you. What happens when you send an email? It goes only to the recipient. It goes to different servers and internet hubs where it stays in their inbox. Which is the best answer? Okay, most of us have voted, and most of us thought that it goes to different servers and internet hubs. Some of us thought it stays in the inbox, but it doesn't do that. It goes to the different servers and hubs. Okay. Last of the 2 more polls. This is second to last. What can happen when protected health information is stolen? Identity theft, bogus bank loans, bogus prescriptions, the victim gets a bad credit history, or all the above. What do you think? Pretty easy. Yep. I thought that was unusual to know as well, that the protected health information was so valuable out there. It's replaced credit cards and all that. And you are correct, all the above. And last but not least, how can you help protect ePHI, which is electronically shared PHI? Use encrypted email, encrypt computer access, and digital storage. Know what PHI is, ensure the receiver has a need to know and release of info. This doesn't have any wrong answer, by the way. It doesn't have any wrong answer. Just pick the one that you think is best. Use encrypted email. It's popular. Know what PHI is. Pick the one you think is the most important. Let's put it that way. Okay. And what did we think? What did we think was the most important one? Using encrypted email, DSM. Encrypting computer access and digital storage access, like you can get your little thumb drive that has a code on it. You can put a code on it so nobody could steal it and open it. You have to know what PHI is, and you have to ensure the receiver has a need to know and release of info. Those are all good. I like the one that you picked as the most important because, of course, that's what we're here today talking about. So, awesome. Okay. That was the last of my polls about HIPAA compliant DSM processes. Do you have any final questions before we close? We don't have to go all the way up to the top of the hour. If we're done, we're done. It's okay. It's a smaller class. Anything else before we're done? Anything at all? You feel prepared to do a HIPAA compliant EMOD request, or to go ahead and send an email to somebody on DSM? Question says, what if you don't get 3 EMOD estimates? You don't have to have 3. You could only get 1. You could get none. You don't have to have 3. Nothing in there said you had to have 3. You just have to turn in the ones that you got. You have to pick the lowest one. And if you're not going to pick the lowest one, you have to fill out the form that says why. And then our director has to look at it and approve it. You don't have to get 3. You could get 1. Other questions, thoughts? Is there any credit for this training or an agenda that can be sent? Something I can give to my supervisor? Yeah, you're going to get an email that says thank you for attending, and you're going to get an email from me that has it has all the attachments in it. Okay, so it looks like we're good. That being said, we'll look for our email to come to you, and we really appreciate you spending time with us today to learn about this topic. We hope we gave you some tools and some things that you might find new and useful for you, and appreciate that you have been together to learn here along with us. And I mean that because we learn along with you as well. All right, so thanks. Have a great afternoon. Thank you from our training team, and we'll see you again online sometime soon. Bye-bye.